Hello, fellow friends at Orchard Ridge. My name is BJ Custer. I am the Director of Rehab here at the Village at Orchard Ridge. I work for a contract company called Functional Pathways, and I am also a physical therapist. Today I want to talk to you all for our Fridays with Functional Pathways presentation. I want to talk about balance training. You'll notice on this slide that I've put down at the bottom that this is an Accelerated Care Plus approach. Accelerated Care Plus, or ACP, is a company that we use here in the rehab department that helps provide additional education throughout the year in regards to many things, urinary incontinence. I received a bachelor's degree from Brigham Young University in Provo, Utah, and I came out east and received my doctorate degree here in town at Shenandoah University. I've been working at the Village at Orchard Ridge for 7 years, and I love being here. I love working with you all, and one of my favorite things doing as a therapist is working with you all on improving your balance. I want to go over some of the risk factors that are associated with falls in the elderly population. There are several, and we'll go through each individual one, but this is not an inclusive list. History of falling, we know based on research that if you have fallen once, you are highly likely to fall again. And if you have fallen one time, it's very easy to brush it off and say, well, that was nothing. If you've fallen once, again, the likelihood of you falling multiple times is astronomical. The older we get, the more likely it is that we're going to fall. There are a lot of factors associated with that: weakness, decreased balance, maybe our vestibular system has weakened. Lots of factors that can increase our risk of falling with age. Different medications, depending on what you're taking and what time of day you're taking it, this can cause dizziness or symptoms of feeling lightheaded. Whatever the case is, medications can often increase our risk. So can chronic pain. If you're walking down the hallway and your pain is grabbing you and causing your legs to buckle, chances are you're going to sustain a fall. Cognitive impairment, maybe you don't know where you're going and somehow you end up in the stairwell, and maybe it's been a while since you've gone up and down stairs, or maybe you're easily distractible. Lots of cognitive impairments that can increase our risk of falling. Visual impairments, of course, if your eyesight is poor, taking care, being slow, especially when being outside, if it's dark out. We've already discussed vestibular systems. If, as I turn my head, if the world continues to spin, or maybe you're constantly dizzy, that would increase your risk of falling. Low blood pressure, another reason why people fall is they stand up and all of a sudden they kind of sort of feel like they're going to pass out. A decreased in lower extremity function, that could be a poor range of motion. Maybe our hips and our knees aren't as mobile as they used to be. Maybe our strength and our power is down. This could increase our risk. One of the things that we don't think about often is urinary incontinence. Of course, if you have a wet surface, maybe it's in the bathroom or in the kitchen, maybe our footwear or our socks have become wet, then of course we would be susceptible to slipping and falling and sustaining an injury. The other two factors, of course, if you're ill, you're going to have decreased strength, maybe make poor decisions because you're just so out of sorts. And then, of course, environmental factors: throw rugs, crowded spaces in your apartment, unfamiliar spaces. Maybe you're going to visit somebody for the holidays and you're not familiar with their walkway out front, and you trip over that one brick that's out of place that everybody knows about because they go and visit, but you didn't know about because you haven't been to go visit recently. But environmental factors are another reason why falls are occurring. One of my favorite studies that was performed in a nursing home, but we can generalize and apply it to this population, is a study where they went in and they tried to find out, these researchers tried to find out what it was that fallers had in common versus non-fallers. So they went into this very large nursing home and they separated those who haven't had a fall and those who have had a fall. and they studied them. They studied age, race, gender. They studied time of day that they get up, walking patterns. Did they use a cane or an assistive device? And what they found out was that there was a correlation, a high correlation between strength of those who were falling and those who were not falling. So for example, here for our group that is non-fallers, here in the blue, you can see that they have high knee extension strength, good quadricep muscle strength. Here in the second one, the hamstring strength is right on par. I mean, just really good numbers. And of course, ankle plantar flexion is high, being able to move your ankle in certain directions, and then dorsiflexion, same thing. Pretty good numbers for our non-fallers. What they found in our fallers here in green is that there's a significant decrease in strength, in hamstring strength, quadricep strength, plantar flexion strength, and dorsiflexion strength, which we'll talk about in this next slide. But here, this is the huge problematic area of people who are falling. In fact, the number one predictor in strength for those who are falling is weak ankle dorsiflexion or weak ankle dorsiflexors. And so we love this as therapists. We love to find correlations and being able to impose interventions that will help reduce someone's risk of falling. And so when we see that weakness is one of the leading factors in falls, well, that's great. Come on in. We'll strengthen you up. We will put you through the right exercises designed for you in order to keep you up off of the floor. Here's an artist depiction of our lower extremities, in fact, from the knee down. And one of the reasons I put this on the slide is because I want to show you this muscle right here on this left image. This is our tibialis anterior muscle. So we talked about weak ankle dorsiflexors. This is our primary ankle dorsiflexor right here. So one of the areas that we are going to target when strengthening is this ankle or this tibialis anterior muscle, making sure that it's very strong in order to fire and activate and keep us upright. We'll talk a little bit later about how this muscle works, but just know that that's the common spot where people who are falling are most weak. One of the areas that we look at when we see people who are entering our fall prevention program is we look at their balance and we try to assess, is there any way that we could help improve their balance and improve their center of balance, their base of support. For example, here, if you look at this artist depiction here of this gentleman on the right, what you'll notice is a plumb line that is dropped right down the mid part of his body. And there are certain parts of the body that we look for that plumb line to pass through. For example, the ear would be one area. Just anterior to the shoulder would be the second area. Right here over the hips, we're looking for that plumb line to pass through there. Right over the knees. And if I get rid of my window pane here, you'll notice also around the ankles, we're looking just anterior to that lateral malleolus. Now over here in this left image, what you'll see is this person has taken on a forward posture. By forward, meaning his head has become more anterior and his shoulders have become more posterior, really exaggerating or accentuating that forward posture, that forward lean. And also, what we're noticing is that the plumb line is passing anterior to his hips. His glutes are being pushed, or his hips are being pushed back. Glutes are sitting too far posterior to be functional and to be recruitable. And then the plumb line is also passing too far anterior from the knees. And so his posture is just really off. So we look at, is there a way to correct this? Is there anything that we can do as therapists to improve that center of balance so that if somebody doesn't come and bump this gentleman and he fall forward because of his forward posture, his center of balance being off from where it should be? What we also look at when we are assessing balance is we want to determine, are people able to recruit that tibialis anterior muscle or those ankle muscles for balance maintenance. And so naturally, when we are trying to keep our balance, we should be able to shift our weight forward and shift our weight backward without losing our balance. Please do not try that at home. I do not want to hear about people falling during my presentation at home. Believe it or not, we don't want to see you down here in therapy. We love you, and if you have issues that you need help correcting, we are here for you. But I don't want you to come and visit me on Monday because you tried this and you've fallen in your apartment. But again, you should be able to have that degree of freedom of being able to shift your weight forward and backward with ease, recruiting the proper ankle muscles and being able to keep you upright. So looking at that tibialis anterior strength is going to be essential. This is the number one area that we are wanting to see strength in. Ankle strategies are the best recruiting strategies for balance maintenance. And if somebody doesn't have ankle strategies, they're not recruiting them, that's our primary focus. The next area that we look at are hip strategies. So ankle strategies are the best. We want the ankles to be recruited. The next best strategy, not the best, but the next best, is hip strategies. If somebody were to bump into me in the hallway, maybe my hips would go posterior, keeping me upright. Or maybe my hips would go anterior, keeping me upright. But being able to recruit larger muscle groups, maybe in our core, our glutes, our quadriceps, hamstring muscles, recruiting those is going to be the next best thing if those ankles, or if somebody bumps us really hard, recruiting those bigger muscles is going to be essential to keeping us up off of the floor. The worst strategy is relying on stepping strategies. If somebody were to bump into me and I have to step to the side in order to recover my balance, or I'm stumbling forward trying to recover, that's almost asking for a complete disaster. If you feel like you are struggling with balance and you're swaying and sometimes you lose your ability to stay upright and maybe crash into walls or bookshelves or whatever it is, you are beyond the point where you should be getting help. You should be coming into therapy in this balance prevention program, strengthening the right muscles, working on balance as best that we can in order to keep you from sustaining a serious injury. Another area that we look at is functional balance. So if I'm at home and I'm picking up objects off of a shelf, maybe I have a stack of books and I'm turning to go place them somewhere, am I able to multitask and lift things and turn and step and cross over my feet and maintain my balance? If I'm not, then the chances are that you're going to have a fall, right? And what we do not want is we don't want people to be falling while turning. It's one thing to fall posterior and land on your bottom and kind of laugh it off and think, well, that was silly, I shouldn't have done that. Or maybe even to land forward, maybe you fall onto the bed or you're able to catch yourself with your hands. But turning and falling, if you were to turn, fall on the side of that hip, there is not a whole lot of protection to that lateral portion of our body that will protect the bone, and oftentimes that's how hip fractures are sustained. Somebody is turning, they fall on their side, break their hip, and have to undergo that painful process of recovery. Of course, in our osteoporotic population, the question is, well, did you fall because the hip broke first and then you fell, or did you fall and break the hip? And oftentimes what we're finding out through research or through examination is that it's likely that the hip broke first and then the person sustained a fall. Another thing that we do in therapy is we look to see what the neuromuscular connectivity is like between a muscle group and the brain. So what we're trying to determine is if your balance is off, if somebody were to push you, is your brain able to communicate to the proper muscles to fire in order to maintain uprightness? When I think of neuromuscular reeducation, I often think of muscle memory, and I think of surfers. The first time a surfer got on a surfboard, I can guarantee you that that surfer ended up in the water before the day was over, if not on the first try. Same thing with our skiers, our snowboarders, our roller skaters, people learning to ride a bicycle. You are going to fall because you don't have that neuromuscular connectivity, that optimal level that we're looking for to keep us safe. But like with surfers, like with skiers, like with bicycle riders, you can learn how to stay up off of the floor. You can learn how to be more balanced. And so that's what we're all about. We're all about firing that nervous system, getting those muscles stronger, making sure that that connection or that communication between your brain and your muscles is optimal to reduce your risk of falling. Of course, exercise is going to be important. The stronger you are, the less likely it is that you're going to sustain a fall. The weaker you are, the more likely it is that you will sustain a fall. The same is true with our activity tolerance, our endurance. If it takes every bit of strength for me to walk from my apartment to the bistro or my apartment to the mailroom, and I am just totally exhausted by the time I get back, you can see how that would increase somebody's risk of falling. But if I'm able to get from point A to point B without much difficulty, or I'm able to stand up out of a chair pretty easily, then my risk of falling would be much less. So we as therapists, we always measure for those that are fallers, we measure strength, we measure activity tolerance, we measure your balance, and we set goals based on those. If you present with really poor strength, our goal is to get you 5 out of 5 strength. If you can only walk 200 feet during a 6-minute walk test, our goal is to get you to walk 400 feet or 800 feet or 1,200 feet, depending on your current level. But it's important to have a thorough assessment to determine what is it that is causing you your recurring falls, or why do you feel imbalanced when walking down the hallway. The next thing that, again, with strengthening that we're looking at is not only putting you through an exercise program, but making sure that it is a progressive, resistive exercise program. We don't want you to come in and just do 25 pounds of a leg press every day for the rest of your life. We want that 25 pounds to turn into 30 pounds, and that 30 pounds to turn into 35, into 50. We want your exercises to become more challenging because your muscles are going to get bigger. We want your muscles to get stronger, which would allow you to do more exercise-wise. Instead of being on the new step for 5 minutes, we want you to be able to do it for 25 minutes or 30 minutes, really improving that activity tolerance. So keeping a nice journal, like an exercise journal, would be important of this is how I felt today versus 3 months from now. This is how I feel, after 3 months of exercise. I personally have done this with some certain goals that I have with weight loss, and it is so important to be able to look back and say, wow, this is where I was, and this is where I am now. I feel so much better. I feel stronger, and it's important to see the progress in what you're doing. So if you're stuck at a certain level in regard to your exercises, maybe it's time to bump them up a little bit. This is one of the machines that we use here in our outpatient clinic. This is called an Omnistand machine. And what this is a machine that allows for dynamic balance. So you can see this gentleman here in the machine. He's got this harness behind him that keeps him pretty much locked into that machine. And it allows him to practice those balance techniques that we want, being able to shift our weight, being able to stay upright and recruit those ankle muscles, that tibialis anterior muscle, making sure that the quadriceps are firing and the core is firing during these dynamic balance activities. We are so blessed to have this machine because it really allows us as therapists to do so much more higher level balance activities with our patients. With a bit of luck, I'm hoping that this video will play and it will give you a preview of what the balance machine does. So we'll see if this works. Okay. So again, this is an ACP, an Accelerated Plus equipment that we use, Accelerated Care Plus machine that we use. So you can see this gentleman is able to do a lot more without that hands-on therapy approach. We can do fun things on the television. We can use our Nintendo Wii, do some fun bowling activities, get you on our Wii balance board. But being able to do dynamic tasks is so important when it comes to balance training. We're able to adjust the resistance of the machine so we can really help strengthen proper muscle groups while doing these balance activities, make them a little bit more challenging, a little harder if necessary. But one thing I want you to notice is how much fun this guy is having, because therapy, it's a blast. I know you all are just wanting to sign up because you hear of how much fun people have down here. But really, we do try to keep things fun and keep things light. Here are some other things that we do during therapy. Again, the more you practice balance, the possibilities are endless. I mean, this is just 1% of the things that we do in therapy, but the more you practice balance, the better you will become at it. And look, there's a maximum level of potential that you can achieve in therapy. But if you're starting way down here, we want to get you up to that maximum level and be able to reduce your risk of falling. Some of the other options that we use in therapy are doing obstacle courses, making sure that you can negotiate crowded environments, unpredictable environments, making sure that when you do go out, maybe to the grocery store or again going to a family member's home that you're not familiar with, that you are able to adapt and react to changes in an environment, to something that is new to you. So being able to negotiate obstacle courses in different environments is essential to reducing someone's risk of falling. I feel like we just scratched the surface. There is so much involved in balance training. Again, this is one of my most favorite things to work on with people because it is fun. This guy in the video, maybe he was a little overboard with how much fun he was having, but it is fun. It's something that shouldn't be boring and challenging, but something that you can come down and feel confident that you'll be safe in a good environment, and that your progress will be monitored. We monitor your progress every single visit. We go over your progress every couple of weeks, make sure that you know where you were versus where you are currently. But we are happy to help. If there's anything that you feel like we could work on in regards to your balance, we are here for you. If you choose to go somewhere else, that's great. I am an advocate for the profession of physical therapy. There is so much good that we can do as therapists if you allow us to help you. If you have any questions about balance training or any of the things that you saw in today's video, please do not hesitate to email me, call me, come down and visit me. I'm always here during the lunch hour, usually free in the afternoon. So I want to be able to answer those questions that you have, and our number one goal is to keep you safe. Again, thank you for tuning in for this Fridays with Functional Pathways. I'm really looking forward to doing this again in person soon. But until then, have a great rest of your day and a great weekend coming up. Thank you all so much.